Hello from the Netherlands. In advance, excuse me for my English. I'm just so excited that we won this award. We are Manouk Kessels and Henk-Jan Idema. We are representing the NFU, the Federation of Dutch University Hospitals, and everyone that is committed daily to improving the patient experience monitor, shortly the PEM. I was mentioning that we are here on behalf of the NFU. However, from November onwards, the NFU will be renamed to UMC NL to better reflect who we are. And in this presentation, I will continue to use the NFU. The NFU represents the 7 university hospitals across the Netherlands and employing over 80,000 professionals. We combine specialized patient care with research and education and facilitate national and international collaboration to improve healthcare quality and innovation. And one example of such collaborative innovation is the Patient Experience Monitor, launched in 2019. It's a national continuous measurement tool that systematically collects patient feedback to improve care quality. All 7 UMCs use the PEM, which has a standardized set of core questions, while allowing UMCs to add locally relevant topics. It's designed to be inclusive, even for patients with limited health literacy. The PEM supports quality improvement at multiple levels, nationally through benchmarking at individual UMC level and within departments, and over 1.5 million patients have participated since its start in 2019. As I mentioned in the PEM dashboard shows real-time results from closed and open questions. And here's a short video to illustrate its features. Here we can select the period, the dates, and then all the UMCs separately or together. And here you can see what questionnaire we would like to see in the dashboard. Here are all the questions shown with its score and its trend. And furthermore, we have the open answers, and there you can see which subject, which category is mentioned here. And how is this PEM evolved? Previously, there were many PREMs that were too long or too complex, leading to low response rate, and especially among patients with limited health literacy. And if you develop the PEM using a validated Picker Institute questionnaire, which was focusing on person-centered care and accessibility, and patients and stakeholders co-created short and clear questions. And if you want to see more details, you can see the article, which is written by one of our colleagues. The questionnaire development involved the following steps. So it was selecting and adapting questions, a expert panel reviews, patient cognitive interviews, psychometric analysis, and member checking. And stakeholders were including patients, healthcare professionals, translators, quality experts, and Picker Institute. And this collaborative process ensured scientific validity and practical use. And for further methodological details, they are available in the article which I referenced in the slide before. Since its implementation, the PEM has empowered Dutch UMCs and general hospitals to gather and act on patient feedback in a structured, real-time way. Its combination of closed and open-ended questions provides both measurable outcomes and rich insights, and the yearly national benchmark report is a key outcome, identifying variations across UMCs and highlighting best practices and improvement areas. It serves as a foundation for shared learning and improvements. And two examples of those best practices are that the communication on waiting times has been improved in 3 of our university hospitals, and another best practice is the development of a text mining tool to help go through the large volume of responses to open-ended questions. The PEM is embedded in quality improvement cycles at all UMCs and all general hospitals. Well, excuse me, not all general hospitals, but several general hospitals. The NFU coordinates nationally with a development and management group, including UMC representatives and a patient representative. The Picker Institute advises on methodology and questionnaire updates, and this ensures that the PEM remains a dynamic, sustainable, and inclusive instrument for enhancing patient-centered care across the Dutch university hospitals. In addition to updating the questionnaires, the current priorities include improving the invitation methods to boost response rates, which has already been done by now, translating questionnaires into multiple languages, enhancing text mining, developing a question library for local adaptations, and upgrading the real-time dashboard for better usability. All UMCs actively promote the PEM in different ways to raise awareness, and the real-time dashboard is accessible to all UMC staff, encouraging transparency and empowering teams to take ownership of patient feedback. In several UMCs, PEM results have been presented to various audiences, including hospital boards, and to support leadership engagement. Additionally, nearly every year a symposium is organized for all PEM coordinators from the UMCs, fostering shared learning, alignment, and the ongoing development of the initiative. The PEM's design and the national coordination make it scalable beyond UMCs. Other hospitals and healthcare systems can adopt the PEM approach to strengthen their own feedback mechanisms and quality improvement strategies. The PEM has already attracted interest from hospitals outside the university medical centers, particularly those affiliated with the NVZ, which stands for the Dutch Federation of General Hospitals. And in 2024, the NFU and NVZ formalized a cooperation agreement to support the broader implementation of the PEM. And as a result, besides the 7 UMCs, 33 NVZ hospitals have now adopted the PEM, demonstrating its wider applicability and growing impact across the Dutch healthcare system. The PEM stands out due to its national scale and reach, and inclusive design and real-time applicability. It enables the collection of patient experiences from large groups by combining standardized questionnaires with the flexibility to add locally relevant questions, and the PEM is both consistent and adaptable. Developed through co-creation with patients and professionals, the PEM is now fully embedded in daily practices across all UMCs. Benchmarking is a key success factor, enabling continuous learning and targeted improvements based on patient feedback. So the key learning points for the PEM is collaborate early and often with all stakeholders, including patients, build flexibility into national content to allow for local relevance, embed patient experience data into quality systems at different organizational levels, ensure accessibility for almost all literacy levels, make results visible and actionable for patients and staff, maintain strong collaboration across organizations to support scaling and ongoing innovations. Those lessons can guide other organizations aiming to embed patient experience into daily improvement cycles. And our ultimate goal, all hospitals in the Netherlands that are measuring with the PEM. So, thank you for your attention, and are there any further questions?